We know that obesity is bad for your heart, but it could also increase your chances of getting cancer. A first-time study exploring a link between the two suggests the longer a woman is overweight, the more likely she is to develop cancer. Now, the good news is that even a small amount of weight loss could really make a big difference. Dr. Scott Ackerman with Ackerman Cancer Institute is joining us now to explain why this link exists and really, quite frankly, what can be done to minimize it. Good morning to you. Thanks for being here. Do appreciate it.
Good to see you today.
So what is the issue with obesity and cancer? Why is there a link here?
Well, we've known for a while that people who are obese are at higher risk for cancer. We've thought this for a while. There's been a lot of initiatives, exercise and lifestyle changes to reduce obesity with the hope that that would reduce the incidence of cancer. But we don't know if there's a direct cause relationship between obesity and cancer. But we do know that people that are obese have a certain lifestyle that is one that is associated with lots of cancers. Smokers are more obese. People that are obese smoke more often. People that are obese eat more sugary foods. They eat more fatty foods, and these things are associated with higher incidence of cancer. Also, people who are obese have higher levels of certain hormones in their body just because of the obesity. For instance, women who are obese have higher levels of estrogen floating, in their blood system, and these higher levels of estrogen are related to higher incidence of breast cancer. So maybe that's the link as well.
You know, a lot of times when we're looking at studies, they're not necessarily big studies, and more research needs to be done. This is not the case, though. I mean, you're talking about, what, 73,000 women participated in this, and there's something specific. This is specifically postmenopausal women, so this isn't teenagers, for example, or young girls that this applies to.
So these are women, as you said, 73,000, a little bit more maybe, who were between the ages of 50 and 79. And they were given questionnaires to asking them about their weight in the different years of their lives and how they best can remember what their weight was at different decades of their life. And that's a lot of data. Yeah. And they found out that for women who are obese have a 10%, for every 10 years they're obese, they have a 10% increased risk of cancer, and women that are just overweight have a 7% increased risk of cancer for every 10 years they've been overweight.
Okay, so we mentioned breast cancer. Any other kinds of cancers in particular that we're finding in terms of this?
So colon cancer is associated with it as well. Kidney cancer, believe it or not, is associated with it as well, and also endometrial cancer. So the connection, breast and endometrial are both related to higher levels of estrogen. So that's why we think that that has something to do with it as well. Colon and renal cancer, it's kind of a little bit of a surprise. Colon cancer might be because the diet, the higher fatty diet, we know that's associated with colon cancer, so maybe obese women eat a diet that's more high in fats.
So it's interesting because, I mean, you probably can ask any average woman and they'll tell you that they have been on a diet for probably half of their life. At least I feel that that applies to me. What if your weight fluctuates? Can that minimize your risk, for example?
Sure, because, as I said, the longer you're obese, or the longer you're overweight, the increased incidence. So, you know, we all go through, men too, little rocky, ups and downs with our weight. And so it's no reason not to look to lose weight, no reason not to have a better lifestyle and exercise. And you should monitor your weight so you see what it is. And
what's encouraging is that you can lose just a little bit of weight and can make a huge difference when it comes to your risk.
Right, absolutely, absolutely. Just as I said, it's a 10% increased risk for obesity and a 7% for just being overweight, and there's just a little difference in that. We measure that using what's called the body mass index. We've talked about that before, I think, and it's easy to go online, and there's these BMI calculators because the formula's a little confusing.
It is, yeah.
But you can plug in your height and weight and get it right away. And I encourage a lot of my patients to do that periodically because it's a good positive reinforcement, or negative, but positive reinforcement that you're doing the right thing.
Well, it's a health check.
Yeah.
Thank you very much, Dr. Ackerman. Do appreciate it. And of course, if you missed any of this interview, you can watch it online later this morning at news4jax.com. Just look under the morning show page. Again, we'll post it in about an hour and a half or so.